Here is your station. There are 2-3 slides. Once you've done reading this, I'll move on.
Okay, move on. Okay, all right then. Mm,
Move on?
a second.
No, that's all right. You can read.
Okay, move on.
This is the second one, yes.
Okay. طب is my level.
First one?
I didn't told my level. Is it SHO, CT1, CT2, SCTO? Okay.
Your level? Here.
Yes.
Informed trauma consultant.
Okay.
Once you're ready, let me know.
Okay. I was just getting this stuff. Okay. I'm ready.
All right. So if you've read and understood, kindly begin.
Okay. Hello. My name is Dr. Nahla Ahmed. I am SHO level. May I confirm I am calling the on-call trauma consultant to update him about a trauma case in the AR?
Yes. Speaking. Kindly summarize your case.
Okay, doctor. Nice to talk to you. I have 20 years old male. I came to our ER at 3 and a half p.m. After RTA, after assessing him, his vitals was stable. His cardiac scale was 15, although the ambulance man told us that he lost his consciousness a bit. On the local examination, we have found that there is an abrasion in his abdomen. We have done abdominal X-ray, which showed and he which showed retro retro okay, which showed the chest X-ray of him was normal, and the X-ray of his lower limb host of tibia and the tibia show both bone fracture. We have done also ultrasounds that showed intraperitoneal fluid. We have given him IV crystalloid, and we have done growth matching. But lately, after a few hours, the nurse updated me that his limb became too pale and pulseless. So we are fearing of developing acute limb ischemia.
Okay. So what is your plan of action?
Okay, my plan of action would by starting to reduce his fracture and calling of the orthopedic and the vascular, and then I would start give complete the trauma survey of the patient by doing CT head, CT abdomen, and CT chest, and I will give the patient to continue giving the patient IV fluid, analgesia, and I make sure that he has no hypokalemia, and
Okay.
they make sure of his tetanus toxoid.
How are you going to fix his fractures?
About his fracture, I will reduce and immobilize his limb.
Okay. Then why are you calling me now? Do you want
Okay,
me to come for the patient?
I'm calling you to update you about the patient and for the possibility of and the need for night surgery for this patient.
Is the patient urgent?
Yes, he developed acute limb ischemia after the open fracture he had.
Okay, tell me, right. What would you do for the wound of the patient?
For the wound of the patient, I will do a surgical debridement in the OR in the first 24 hours.
Does the patient has cervical collar?
I'm very sorry for this. I'm not sure. I will check this one time of the telephone with you.
Why are you going to call a general surgeon for the ultrasound of the abdomen?
Okay, we have found that there is a free fluid collection that is may be an indication of intra-abdominal bleeding. So we need to do urgent laboratory if there is something like this. And for his the debridement of his tissue injury.
Okay. Who else are you going to involve in the management of this patient?
Okay, to complete management of this patient, I will involve the theater manager, the anesthesia, the general surgery, the orthopedic, the vascular, the plastic, the neurosurgeon.
Why are you going to involve plastic surgeon for this?
Because we may need a flap.
Okay, why, how are you going to manage the free fluid in the abdomen?
If there is a free fluid in the abdomen, this is an indication if there is organ injury or intraperitoneal hemorrhage, so we need an emergency laboratory.
Okay. What else are you going to do for the limb, pulseless limb?
For the muscle limb, okay, I would reduce and mobilize the limb because if there is a kinking or of the limb of the vessel, and I would do a failure and I check if the vasculature is returned intact, and if there is not, and I would do the duplex and take a consent from the patient and prepare the patient for the vascular surgeon when he is ready.
Do you think patient is dehydrated?
For the his clothes trust, I'm not sure about this picture. I'm very sorry for this, but I will check this after the call, and I will see you.
Okay. What are you going to check before sending the patient to the operation theater?
Okay, I will do for this patient some investigations. I will do for him EBG and electrolyte and his coagulation profile, liver function test, renal function test.
Yes, in analgesia and traction.
Yes, yes, I'll give you
All right. Okay.
Okay.
All right. Yes, carry on with the patient. And if needed, tell me.
Okay, thank you, doctor. I will check the traction IV fluid and his labs, and I will prepare for his stage. Thank you.
All right. Thank you.
Okay. So the feedback.
Yes.